we're going to be going over what I'm calling Joe's Butterknife Graston technique. And so what this is a way to work superficial fascia and to kind of unstick it from the underlying tissue below. And so a quick kind of primer on superficial fascia, it is basically the layer of the skin on top of other stuff, whether that's muscle or bone. It's what, for example, you can see I can kind of move the skin of my hand. I'm not scraping it, but I'm actually moving it. And so that's healthy superficial fascia. And what can happen with injuries, but also with radiculopathy or nerve pain, is the superficial fascia, say on the leg, gets kind of really stuck. For lack of a better word, it gets fried. It gets really adhered down. And so even though the nerve pain is gone, the stickiness prevents normal efficient movement. And so what we want to do, and what I'm going to demonstrate, is how to both identify tension in the superficial fascia and then basically treat it out using our butter knife. And so the first thing I'm going to show you, and I'm going to come closer here, is if we're just talking about the leg. And we'll talk about the lower leg, but this could be applied to upper leg and the hip or down to the shin. We want to first assess how this moves and just how the tissue moves in general. And so when I do this, you can see I'm moving superficial fascia for sure. I'm also moving some muscle. But when I take my hands and sort of swirl or rotate inside and outside, I'm seeing, just like with my hand, how I can move that fascia on top of the underlying tissue. And I'm looking for stiff spots. So for me, I'm not too stiff up here, but let's see. I can spin that pretty good. I feel some tension this way when I spin out, down here. If I spin in, actually I'm doing pretty good here. There's not much there. But it's interesting, I do feel tension and a relative mobility deficit. You can see I don't move very well this hand. That's it, it stops. But then if I switch, watch how much I move there. So I've just identified a stiff spot here. I can also sort of localize that even further by saying, okay, it doesn't twist out. Can it go out and down? That's okay. Out and up, that's tighter. So I want to work here and I want to work in this direction. And so this is where my tool comes in. In Graston tools, it's a soft tissue technique, and they're really expensive and weird kind of metal things. But use a butter knife, use the dull edge of it. And you can even use the handle of it. But what we're gonna do is basically scrape the skin. And what you're trying to do is sort of create a wave. In the same way that if you kind of zoom in and you can see, I'm getting a wave, sort of this rolling of the skin. That means that it's moving. And so I can go on my leg. And so I remember, this is my stiff spot and this is my stiff direction. I'm going to just scrape and try to, you can see I'm waving that tissue up and just trying to get it moving. And it doesn't need to be super specific. It obviously doesn't need to be super hard because I'm not wincing here, I'm not bleeding. And so you're just giving this tissue a nice wave. It might burn, and that's what fascia feels like when it's kind of stiff and you're getting it moving. But I'm just gonna go in that direction and then just kind of feel out, are there any other stiff areas? That's totally fine. You can feel that, you can see, I can feel, it moves really well. Right there, not so much. And so it doesn't take much time, a couple minutes. And I can come down here, this kind of feels tight. I've got much more tension in my calf that I could work on, but we'll just talk about the thigh. And now let's retest this. If I spin, I think I now have better motion. And so for me, this isn't as important as for some of you guys that have significant range of motion deficits and pain. What you're gonna notice is if you have fascial tension and try this technique, it should move a lot farther with a lot less pain, and hopefully then functionally when you go for a run, that this is gonna move a lot better with less pain. So give that a try, whether your issue is up at the hip, in the thigh, around the knee, or even down into the calf. Check out how your superficial fascia moves, give it a little self-assessment, and when in doubt, scrape it out.